Well, welcome everyone. It's so great to have you all joining us this evening, and we're so excited for the opportunity to present to you tonight. I'm preparing for those pharmacology questions that are on both your nursing exams and on the NCLEX. So here we have a little agenda, and in tonight's session, we will practice answering pharmacology test questions, and we will review rationales and strategies. We've selected practice questions based on common prescribed meds and what we know you will most likely be asked on NCLEX. So on this next slide, let's start by reviewing some general medication guidelines. So first, medication absorption, distribution, metabolism, and excretion are affected by age and physiological processes. So it's important to remember that the older client and the neonate and infant are at greater risk for toxicity than an adult is. This is an important point. If there is an age specified in a question, be sure that you pay attention to the age and think about physiological processes related to growth and development and aging. So next, antacids are not usually administered with medication because the antacid will affect the absorption of the med. So don't select the option that indicates giving the client an antacid with the medication or within 2 hours of medication administration. Next, grapefruit juice is not usually administered with medication because it contains a substance that will impede the absorption of the med. So don't select grapefruit or grapefruit juice as an option if the question asks what you should give when administering a medication. Enteric-coated and sustained-release tablets should not be crushed, and also capsules should not be opened. So if you have a question about a client who has difficulty swallowing, remember your best action is to see if you can obtain a liquid form of the medication, and if not, consult with the pharmacy about an appropriate form of action as far as crushing tablets or opening capsules. Okay, so Angie's going to take over on this next slide.
Great, thank you, Linda. Hi,
You're
everybody. Okay, so just a few more guidelines, and then we'll show you how to access pharmacology and practice questions for pharmacology in the Evolve resources. So some general guidelines: nursing interventions always include monitoring for intended effects, side effects, adverse effects, or toxic effects of the medication. You want to focus on what the question is asking you. Is the question asking about an intended effect, a side effect, an adverse effect, or a toxic effect? Because that will make a difference in how you're going to answer the question. So let's break this down a bit further. An intended effect is the therapeutic effect that you want to happen. For example, the intended effect of an antihypertensive is to lower the blood pressure. A side effect is one that can occur from a medication. It's not usually directly harmful and can often be prevented. So for example, if you know that codeine can cause constipation, then stool softeners would be important, as well as teaching the client about the importance of fluids and a high fiber diet. And so again, a side effect is not directly harmful, it's more annoying than anything else. Another example would be with your ACE inhibitors. Cough is an annoying side effect, but it's not harmful, but sometimes annoying to the point in which the physician would need to change the medication to a different one. And then talking about adverse and toxic effects, these are very much unwanted and they can be life-threatening. For example, an adverse effect could be an allergic response to a medication, and so you'd want to stop or withhold that medication and report that event. And then a toxic effect produces signs and symptoms, but is also monitored potentially via a laboratory test perhaps. For example, in digoxin toxicity, the client may experience GI disturbances such as anorexia, nausea, or vomiting, or possibly visual disturbances. And this would alert you as the nurse of a problem, and it may lead you to suspect toxicity. Then the digoxin level lab results will show that the digoxin blood level is greater than 2 in conventional units, thus indicating or confirming the toxicity. The nurse or client should never adjust or change a medication dose, abruptly stop taking a medication, or discontinue a medication. The nurse may withhold a medication if they suspect that the client is experiencing an adverse or a toxic effect of a medication, but then the nurse should immediately contact the physician if either of these effects occurs. So for example, if you know the signs of digoxin toxicity in your client, your client is due for their next dose of digoxin, you would withhold that medication until you did a further assessment and you determined the cause of the client's symptoms. And then the nurse may also withhold the medication as well if specific parameters are prescribed and withholding that medication is indicated based on those parameters. An example of this might be if the physician wrote to hold metoprolol, which is a beta blocker, for a systolic blood pressure below 90. In general, the client needs to avoid consuming alcohol and avoid smoking. So no smoking, no use of alcohol when you're answering test questions. Don't be tempted to select an option that reads something like, the client can have an ounce of alcohol a day, or they can smoke 1 cigarette a day. There's no smoking, no alcohol on any exam. And then learn generic names. Trade names are generally not going to be seen on the NCLEX. And so you'll not see a name like Lasix, but instead you would see furosemide. So during nursing school and in preparation for your NCLEX, you want to be sure to learn the generic names. All right, and so then moving forward, we want to share some SMART study approaches. Our first SMART study approach is that you access the NCSBN website at www.ncsbn.org and download your RN or your PN test plan and use that test plan as a study guide. It actually lists all of the nursing activities that you'll be tested on. And then also this website has many valuable resources for NCLEX candidates. And so we highly recommend visiting the site. If you look at the RN test plan and the PN test plan side by side, you really wouldn't note many differences. Most relate to intravenous therapies and some management roles. As far as pharmacology, the RN NCLEX test plan dedicates 12 to 18% of questions to pharmacology and intravenous therapies, and then the PN, they dedicate 10 to 16% to these areas. And then next, practicing test questions is the key to success. We recommend that you practice as many questions as you can before a nursing exam, and then of course before taking the NCLEX. And in fact, we recommend that you practice at least 3,500 to 4,000 questions before taking the NCLEX. And we want to stress the importance of reading rationales and strategies for every question. This will really help with answering future questions about similar content. We also recommend starting with using study mode in Evolve, which I'll show you shortly, because this mode will provide you an immediate answer, rationale, and test taking strategy after you submit your selected answer. And then once you've mastered the content, you can then move to the exam modes. And so how do you locate these questions and resources? You can use SMART study approaches in Evolve to really target and review depending on which medication classifications you're studying. The comprehensive review for the NCLEX RN and PN and the Q&A review for both the NCLEX RN and PN have the capabilities that I'm going to show you shortly. But first, I'll turn it back over to Linda.
Thank you, Angela. Okay, on this slide here, we want to share with you some resources that will be helpful while you're in nursing school and preparing for those nursing exams and in preparation for the NCLEX. So on the top left, you'll see the strategies book, and this is a fantastic resource for RN and PN students that provide you with all of the specific strategies for answering test questions, from how to avoid reading into questions all the way to tips for prioritizing and tips for answering pharmacology questions. In fact, there's a specific chapter that focuses just on pharmacology tips and strategies. There's over 1,200 practice questions, and about 115 of them are pharm questions. So if your weakness is test taking and how to answer the questions correctly, this is a definite must book for you. And then to the right of that, you can see the comprehensive review book for the RN with the PN version just below it. And these books serve a dual purpose and are great resources while you're in nursing school and preparing for the NCLEX. These books contain both content and thousands of practice questions, and you can select the practice questions based on what you're learning in school, such as maternity, PD, adult health, or your pharmacology. And the RN book has over 1,000 pharmacology questions, and the PN book over 700 pharm questions. And then to the right of that, the next resource is the RN and the PN Q&A review. And these books contain all practice questions different from the ones in the comp review books, and are higher level questions that really challenge your clinical judgment abilities. And as with the comp review book, you can select pharm questions based on body systems such as cardiac meds, or even more specifically, you can filter down to a medication classification such as ACE inhibitors. And there are well over 700 pharm questions in the RN and the PN Q&A books. Then there's the online review, which is designed based on the NCLEX Test Plan. There's module content, module content reviews, lots of practice questions, video lectures, self-check questions, plus much more. And this is a great NCLEX prep tool. And again, it actually follows the NCLEX test plan. So on this next slide, we just wanted to quickly provide you with a visual of what a pharm chapter looks like in the comprehensive review books for both the RN and the PN. So here we actually have an endocrine chapter showing you some content on insulin, some boxes, and a figure of insulin injection sites. And then on this next slide, we want to show you a pharmacology chapter in the strategies book. And this page presents the differences that Angela talked about between medications effects and shows you many study tips and provides you with a practice question. So every question in this book also provides a tip for the nursing student that provides some key information about the content of the question. So now we're going to move on to the next slide, and Angela is going to show you how to navigate and evolve so you can get those pharmacology questions that you need.
All right, so let me show you this here. So this shows you what the Evolve resource screen looks like. And so once you get in here and you log in using your Evolve username and password, if you click study, this is the study mode that I was referring to earlier. And then you go to content area. And then we're talking about pharmacology. So you hit the pharmacology drop down and you can see that it's organized by body system for pharmacology. And then we also take it one step further, and let's say you're working on cardiovascular medications and you're going to be tested on anticoagulants and you're going to be tested on beta blockers. So then you can see you've got 54 practice questions on those specific drug classifications. And students have told us that that's quite helpful to be able to filter all the way down to the drug classification in terms of studying throughout their program. And then just another quick example here, let's say endocrine, and then you're going to be doing insulin and oral hypoglycemics for one of your exams. So you can just study questions on those specific medication classifications. If you have an exam that's just on an entire body system, then you could just focus on that as well. All right, so we're gonna jump back into our presentation, and I'm gonna talk about a few very important things before we start on our practice questions. And we wanted to just remind you that we have a list of the top 100 prescribed medications in the United States. And this is located on the last page of the comprehensive review book. And so be sure to review this and be familiar with these medications. And one thing I do want to mention here is that currently this list of the top 100 medications is in the NCLEX-rn comprehensive review book, and it will be coming with the new edition of the comp review for the NCLEX-pn. So you'll be able to take advantage of that when the new edition comes out. All right, and then Linda, I think you're going to pick up from here.
Yes, this slide, we're very excited to announce the publication of our new app. So many students have been asking us for an app for a while now, and now we have the app to offer to you as a way to prepare for your exams and the NCLEX. And there are apps for both the RN and the PN resources. So we encourage you all to take a moment to download the Skyscape Saunders Review app that's best suited for you. And the QR code is here for you. So there's practice questions for all content areas on these apps. But what we have is a pharmacology example of what the app has to offer. So you can see how to navigate to the essential drugs from a list, from the Q&A for the RN app home screen, which will be the same process for any of the apps. So you can click on each drug to see a broken down summary of exactly what you will need to know on the NCLEX exam. And as we've shown here, we have albuterol. All of this information plus 400 practice questions are included with the free version of the app. Then you also have the option to purchase the full version of the app with thousands more practice questions and additional content. So as you can see, we've got lots of resources for you to prepare for your nursing exams and the NCLEX. So now we're going to move on to some practice questions, and I'm going to turn this over to Angela.
All right, let's jump right into this first practice question on ATORVASTATIN. So I'll read the question first, and then Jenna will open up the polling for you to practice the question. ATORVASTATIN has been prescribed, and the nurse provides instructions to the client about the medication. Which statement by the client indicates the need for further teaching? 1, this medication will lower my cholesterol level. 2, I need to have blood tests drawn while I'm taking this medication. 3, I won't need to be on a low-fat diet as long as I take this medication faithfully. Or 4, I need to talk to my doctor before taking any over-the-counter medications. All right, so it looks like 86% of you guys chose option 3 as the answer, and that in fact is the correct answer. So very nice work on that. So going over this a little bit, ATORVASTATIN is a reductase inhibitor that's used to treat high cholesterol and high triglyceride levels. The client's instructed to follow a recommended diet, usually a low-fat diet, as an important component of the therapy. Liver function tests and cholesterol and triglyceride level determinations will be performed periodically while they're taking this medication. And the client needs to be instructed to consult with the physician before taking any over-the-counter medications because of that potential for medication interactive effects to occur. And so it's really important to note the strategic words in the question, need for further teaching. This phrase indicates a negative event query, and it asks you to select an option that is an incorrect client statement. So recalling the action of this medication and using general guidelines related to medication administration will help to direct you to option 3 as the correct option. And then we have our next question on nitroglycerin. This one happens to be a select all that apply question. And so I don't believe we'll be able to use the polling feature with this.
We do have a poll.
Oh, we do have a poll. Excellent. Never mind. Disregard that. You can poll with this question. So I'll go ahead and read it first and then we'll open the poll. A hospitalized client with coronary artery disease complains of substernal chest pain. After assessing the client's heart rate and blood pressure, the nurse administers 0.4 milligrams of nitroglycerin sublingually. After 5 minutes, the client states, "My chest still hurts." Which actions would the nurse take? Select all that apply. 1, call a code blue. 2, contact the client's family. 3, assess the client's pain level. 4, check the client's blood pressure. 5, contact the primary healthcare provider. And 6, administer a second nitroglycerin 0.4 milligrams sublingually. All right, let's see how you did here. So I'll start by telling you guys what the answer is. The answer is going to be option 3, assess the client's pain level. Then option 4, check the client's blood pressure. And option 6, administer a second nitroglycerin. So it looks like about 90% went with option 3, 89% with option 4, and then 82% with option 6. And then also option 5 did seem to be an attractive option as well at 45%. So let's talk about this a little more. First, the usual guidelines for administering nitroglycerin to a hospitalized client includes administering 1 tablet every 5 minutes as needed for chest pain for a total amount of 3 tablets. If the client does not obtain relief after taking a 3rd dose of nitroglycerin, that's when the healthcare provider needs to be notified. Because they're still complaining of chest pain, the nurse would administer a 2nd tablet and then would assess their pain level and check their blood pressure before administering each dose because of the fact that it can cause hypotension. There's no data in the question that indicates the need to call a code blue. And then in addition, it's not necessary to contact the client's family unless they've requested this. And so when answering select all that apply questions, you want to use the yes or no approach for each option, focusing on the data in the question, using the yes/no approach as you read each option. And then for this particular question, you can also use the steps of the nursing process to determine that assessing the client's pain level and checking their blood pressure are appropriate actions. And then recalling the usual guidelines for administering nitroglycerin tablets will also assist you in determining an appropriate action is to administer a 2nd one in this scenario. All right, so now we've got a question that focuses on ferrous sulfate. A client is diagnosed with iron deficiency anemia and ferrous sulfate is prescribed. The nurse would tell the client that it's best to take the medication with which food? 1, milk, 2, tomato juice, 3, seltzer water, or 4, pineapple juice. All right, interesting. So it looks like majority wanted to go with option 1, 46% wanted to go with milk, while only 18% tomato juice, 10% with seltzer water, and then 25% with pineapple juice. That's interesting. So the answer here is actually going to be option 2. So ferrous sulfate, it's an iron preparation, and the client is instructed to take this medication with orange juice or with another type of vitamin C containing product or a product high in ascorbic acid, such as tomato juice, because this will help to increase the absorption of the iron. You also want to note the strategic word best. Among the options presented, the tomato juice is the highest in vitamin C and ascorbic acid. There's approximately 25% vitamin C in a glass of pineapple juice, whereas there's about 75% in a glass of tomato juice. And actually, milk inhibits the absorption of iron, and seltzer water doesn't contain any vitamin C. All right, so then next we have a question on phenytoin and an adverse effect of this medication. A client diagnosed with a seizure disorder is receiving phenytoin 100 milligrams 3 times daily. Which finding indicates that the client is experiencing an adverse effect of the medication? 1, fatigue, 2, dizziness, 3, drowsiness, or 4, bleeding gums. All right, so it looks like 69% chose the correct answer here, which is option number 4. So phenytoin, also known as Dilantin, is an anti-seizure medication. If you didn't know this, you can focus on the data in the question and note that a diagnosis of seizure disorder is provided there for you. And so if there's a diagnosis noted in any pharmacology question, this can help you to determine what the medication is if you didn't know or what it's being used for. A very important adverse effect specific to phenytoin that you're likely to be asked about is that it causes gingival hyperplasia. Gingival hyperplasia causes bleeding, tenderness, or swelling of the gums. And so be sure to remember this about this medication. Fatigue and drowsiness are kind of comparable or alike or similar options, and so you can eliminate these as adverse effects. Dizziness may occur, but in this case is not an adverse effect. So be sure to note what the question is specifically asking about, and in this question, you can see it's asking about an adverse effect. All right, so next, Linda's going to go over a question about amoxicillin.
Thank you, Angela. Okay, on this slide, we have another question about an adverse effect, and the medication is amoxicillin. So a client diagnosed with a genitourinary tract infection is receiving amoxicillin 500 milligrams every 8 hours. Which sign or symptom would indicate to the nurse that the client is experiencing an adverse effect related to the medication? 1, nausea, 2, headache, 3, hypertension, and 4, watery diarrhea. Okay, well, I think you did great with this question. 61% of you selected option 4, and option 4 is the correct answer. Now, what you want to remember is that amoxicillin is an antimicrobial or an antibiotic, and adverse effects of many of the antibiotics include superinfection, such as potentially fatal antibiotic-associated colitis, and that results because of the altered bacterial balance that occurs in the intestines when you take antibiotics. And some signs and symptoms would be abdominal cramps, severe watery diarrhea, and fever. The side effects of this medication include gastrointestinal disturbances, such as a mild diarrhea perhaps, and nausea and vomiting, headache, and sometimes oral or vaginal candidiasis. Hypertension is not associated with the use of this med. And then now note that the question, again, is asking for that adverse effect. And if you can remember that these antibiotics have a tendency to produce these severe gastrointestinal disturbances, and you note the word watery in option 4, that's going to really help you answer this question correctly. Okay, on the next slide, we have a question on levodopa. And we're going to look at our strategic word here. The nurse is caring for a client diagnosed with Parkinson's disease who has recently been prescribed levodopa. What is the most important assessment? That's probably assessment. What is most important to monitor, before ambulating the client? 1, the client's history of falls. 2, the client's orthostatic vital signs. 3, assistive devices used by the client. And 4, the degree of intention tremors exhibited by the client. Okay, looks like you did great with this question. The answer is option 2, and 58% of you did select the correct answer. So your clients with Parkinson's disease are at risk for postural, also known as orthostatic hypotension, from the disease process. And this problem is exacerbated with the introduction of levodopa, because levodopa can also cause postural hypotension. So this places the client at risk for falls. And although history of falls and knowledge of the client's use of assistive devices is helpful, it's not the most important piece of data on the basis of the information in the question. And then it's important to remember that clients with Parkinson's disease generally have resting tremors, not intentional tremors. So note those strategic words, most important. Remember that postural hypotension from the options provided presents the greatest safety risk to the client. And also use your ABCs, airway, breathing, and circulation. And this would also help you answer this question correctly. Okay, on the next slide, we have a question on furosemide and strategic words here again. A client experiencing difficulty breathing and increased lung congestion was prescribed furosemide 40 milligrams to be given intravenously. After 1 hour, which finding indicates that the therapy has been effective? 1, the lungs are clear upon auscultation. 2, the urine output has increased by 400 ml. 3, the serum potassium has decreased from 4.7 to 4.1. And 4, the blood pressure has decreased from 118/64 to 106/62. Okay, you did really great with this one. Also, 66% of you selected option 1, which is the correct option. So let's take a look at this. So furosemide is the generic name for Lasix, and it's a potassium wasting diuretic. And in this situation, furosemide was given because the client was experiencing difficulty breathing and had increased pulmonary congestion. So although all notations in the options may occur, option 1 is the reason that the furosemide was administered. So remember that when a diuretic is administered, urine output will increase, and also remember that the blood pressure will drop as a result of fluid loss. And with furosemide, it's very important to remember that the potassium level can drop because this medication is a potassium wasting one. However, even though the potassium level dropped in this option 3, it is still within the normal range of 3.5 to 5.0. So these are all important points about the medication, but again, focus on the data in the question, note the word effective, and note the relationship between the words pulmonary congestion in the question and option 1. Okay, on this next slide, we have a question on metformin and a strategic word in this question. The nurse is assessing a client taking metformin. Which finding requires immediate notification of the primary healthcare provider? 1, hyperventilation. 2, abdominal bloating. 3, complaints of diarrhea. And 4, complaints of unpleasant metallic taste. You did great on this one also. 52% of you selected option 1, which is the correct answer. Let's take a look at this. Now, metformin, you may also know this as glucophage, and it's classified as an oral hypoglycemic, and it acts by improving glycemic control in diabetics. But a serious and potentially fatal complication of the medication is lactic acidosis, and this is manifested by hyperventilation, malaise, drowsiness, and the condition could advance to cardiovascular collapse, causing some shock if it's not recognized, and treated immediately. So abdominal bloating, diarrhea, and an unpleasant metallic taste are side effects associated with this medication. But again, look at the question, note the word immediate, notification of the primary healthcare provider. So this should be a clue to you that you're looking for an option that identifies a serious concern or an adverse effect. And with this question, you could also use the ABCs, airway, breathing, and circulation, to answer the question. Okay, on the next slide, we have a question on the corticosteroid.
I just wanted to clarify one thing. There was some confusion that I had in the poll, mistyped abdominal bloating as abdominal bleeding, but just wanted to clarify that should have been abdominal bloating in the poll. So
thank you, Jenna. Yes, abdominal bloating is associated with this medication. Abdominal bleeding is not at all. Okay, so it is abdominal bloating that these patients could have when they're taking this medication. But that's a side effect and wouldn't require immediate notification of the healthcare provider, primary healthcare provider. Okay, so on this slide, we have a question on the corticosteroid prednisone. The nurse provides instructions to a client who has a prescription for long-term prednisone. Which instruction would the nurse include? 1, take the medication at night in order to enhance sleep. 2, sometimes a sore throat may be felt, but this is not a concern. 3, the medication should not be stopped abruptly because withdrawal symptoms can occur. And 4, sudden weight gain is normal with this medication and does not need to be reported unless it becomes extremely bothersome. Okay, let's see here. Let me just scroll down. You guys did great. 82% of you selected option 3, and option 3 is the correct answer. Okay, great. So note what the question says, long-term prednisone and client instructions. Now we know that prednisone is a corticosteroid. It inhibits the body's inflammatory response. Now a little tip, most of the corticosteroid names end in the letters S-O-N-E. So this is one way to recognize your corticosteroids. Now, withdrawal symptoms can occur if the medication is abruptly discontinued. So the client needs to be weaned off this medication, especially if the medication has been taken on a long-term basis. So the nurse should teach the client to take this medication early in the morning in order to mimic the body's natural burst of a corticosteroid. So morning is the best time for taking this med, not at night. And additionally, the medication can cause insomnia, so taking it at night is really not a great thing. A sore throat and sudden weight gain are adverse effects associated with the use of this medication, and they should be reported to the physician immediately. And just a few other points to remember about prednisone is that it can cause elevated glucose levels, and it can also cause hypokalemia. So the client with diabetes who's taking prednisone will need to be closely monitored, and adjustments in insulin may need to be made while they're taking the medication. And the client at risk for hypokalemia, such as the client taking a potassium-wasting diuretic, will need to have their potassium levels monitored very closely. Okay, so on the next slide, we have a question on the anticoagulant warfarin, and we have a negative event query here. So a client will be taking warfarin sodium at home on a daily basis. The nurse provides instructions about the medication and determines that further teaching is needed if the client makes which statement? 1, I need to have blood levels tested frequently. 2, I need to increase foods in my diet that are high in vitamin K. 3, this medication thins my blood and then it clots more slowly. And 4, if I notice any bleeding or bruising, I need to call my doctor. Okay, great work again. 85% of you selected option 2, and option 2 is the correct answer. So warfarin is also known as Coumadin, and it's an oral anticoagulant that is used mainly to prevent any thrombotic events such as thrombophlebitis or pulmonary emboli, or any embolism formation caused by atrial fibrillation, or even some other disorders. And oral anticoagulants prolong the clotting time, and they're monitored by the prothrombin time and the International Normalized Ratio, or the INR. Client education should include signs and symptoms of adverse effects, primarily bleeding, and dietary limitations, such as limiting foods high in vitamin K, because foods high in vitamin K increase the clotting time. Some of these foods are leafy green vegetables, cheese, egg yolks, things like that. So with this question, you need to be sure that you note the strategic words, further teaching is needed, and these words indicate your negative event query and ask you again to select the option that's an incorrect client statement. So recalling that warfarin is an anticoagulant will help you answer and assist in eliminating options 1, 3, and 4. And also remembering the role that vitamin K plays in the clotting mechanisms will help direct you to the option that indicates the need for further teaching. Okay, on this next slide, we have a question on morphine sulfate, and we have a strategic word here in the question. So a client is receiving morphine sulfate via a patient-controlled analgesia pump. What would the nurse check initially when assessing the client? 1, a PCA pump, 2, temperature, 3, urine output, and 4, respiratory status. Okay, awesome work. 96% of you selected the correct answer, which is option 4, respiratory status. So what we really want to remember about morphine is that it depresses respirations. That's the key point to remember. Test questions about morphine that you're going to see on your nursing exams or on the NCLEX are going to focus around that point. So the nurse monitors the respiratory status of the client receiving morphine very closely. And you want to check the client before you check a piece of machinery. So that's another important point to keep in mind. So note the word initially. Use the ABCs, airway, breathing, and circulation, to help guide you to the correct option. And although options 1, 2, and 3 may be a part of the assessment, option 4 identifies the priority, so thus is the initial nursing action. Okay, on this next slide, we're going to turn this over to Angela. And go ahead, you're all set.
Thank you, Linda.
You're welcome.
All right, next question. A client has a prescription for ketoconazole. Which instruction would the nurse teach the client to follow while taking this medication? 1, avoid exposure to sunlight. 2, limit alcohol to 2 ounces per day. 3, take the medication with an antacid. Or 4, take the medication on an empty stomach. All right, you guys did fantastic with this one. 69% of you chose option 1, which is in fact the correct answer. So for this question, we want you to focus on the subject, which is client instructions for this medication. Ketoconazole is an antimicrobial, and it's further classified as an antifungal medication. The client should avoid exposure to sunlight because the medication increases photosensitivity. This is an important point to remember about antimicrobials. And remember, you guys did good. No alcohol on the exam. In addition, the client needs to be instructed to avoid the concurrent use of alcohol because this medication is also hepatotoxic. Antacids should be avoided for 2 hours after the medication is taken because gastric acid is needed to activate the medication. This medication should be taken with food to prevent GI disturbances. And so just remember to use those general guidelines related to medication administration to eliminate taking the medication with some alcohol and taking the medication with an antacid. And then from the remaining options, it's necessary to know that the medication causes a photosensitivity reaction and should be taken with food because of the GI disturbances. So nice work on that. Next, we have a question on a monoamine oxidase inhibitor. It's a select all that apply question. A client's been prescribed a monoamine oxidase inhibitor, or MAOI. The nurse would tell the client that which foods are acceptable to consume. Select all that apply. 1, figs, 2, lemon, 3, bananas, 4, oranges, 5, avocado, and 6, summer squash. All right, so looks like we're kind of across the board here. So let's just go over the correct answers. The answer is going to be option 2, lemon, option 4, oranges, and then option 6, summer squash. So if you focus on the subject of the question, which is client instructions about foods to eat with an MAOI, the client taking an MAOI medication should be advised to avoid eating foods that are high in tyramine. The tyramine in foods reacts with the medication, which can cause a hypertensive crisis, and it could prove to be fatal. Fruits and vegetables are naturally low in tyramine, with the exception of figs, and then bananas in large amounts, and then avocados if they're especially overripe, soybeans, and sauerkraut. So you can see 2, 4, and 6 are going to be your correct answers here. Okay, so next we've got a question on the medication isoniazid. A client has been prescribed isoniazid in the treatment of tuberculosis or TB. What would the nurse plan to monitor during therapy with this medication? 1, vision test results, 2, hepatic enzymes, 3, hemoglobin and hematocrit, or 4, the blood urea nitrogen or BUN and creatinine. All right, so 44% of you chose option 2, which is the correct answer here. So this medication, isoniazid, there's the risk for hepatotoxicity with this medication. And so for this reason, the client's hepatic enzymes are measured before and periodically during therapy. Vision testing is done during treatment with the medication ethambutol, which is another anti-tuberculosis medication. Hemoglobin and hematocrit values are unrelated to this question. And then BUN and creatinine are measured during therapy with a medication called streptomycin, which also is a nephrotoxic medication. And so important to remember is that isoniazid is contraindicated in clients with hypersensitivity or with acute liver disease. Okay, next question is a select all that apply question on levothyroxine. Which medication instructions would the nurse provide to a client who's been prescribed levothyroxine? Select all that apply. 1, monitor your own pulse rate. 2, take the medication in the morning. 3, notify the primary healthcare provider if chest pain occurs. 4, it may take 1 to 3 weeks for a full therapeutic effect to occur. And 5, expect the pulse rate to be greater than 100 beats per minute. All right, very good, you guys. Looks like there were a number of you ranging from 61 to 84% that chose all of the correct options, which is option 1, the pulse rate, 2, taking the medication in the morning, 3, notifying primary healthcare provider if chest pain occurs, and 4, that it may take 1 to 3 weeks for a full therapeutic effect to occur. So levothyroxine is a thyroid hormone, and the client is instructed to monitor their own pulse rate. They're also instructed to take the medication in the morning before breakfast to prevent insomnia and to take the medication at the same time each day to maintain those hormone levels. The clients also told that the full therapeutic effect may take 1 to 3 weeks and that they need to have follow-up thyroid blood studies to monitor therapy, and thyroid replacement is often lifelong. Additional instructions would be including the primary or contacting the primary healthcare provider if the heart rate is greater than 100 beats per minute, and then notifying them if chest pain occurs or if weight loss, nervousness, tremors, or insomnia develops. And so you think about the effects of the medication as you read each of these options. Noting the words greater than 100 beats per minute in option 5 will assist you in eliminating that option, and you wouldn't expect that to occur. Okay, and so with that, we'd like to open it up for any questions. And we also want to thank you for spending time with us this evening, and we wish you all the very best. And we want to just remind you to stay positive and believe in yourself. You can do this, and we hope that you stay safe and have a great night. But before we let you go, we'll take a few questions.
Thank you, Angela, and thank you, Linda. That was so great, and there's been so many questions coming in, so we can get to a few right now. The first question I wanted to address was, do you have any tips on how to recognize the class a medication belongs to?
Angela, do you want to answer that? Do you want me to?
I can take that first question, and then you can add
Okay.
as you feel that you need to. So tips to recognize how to recognize the class a medication belongs to. The first thing that you want to do is read the question, note if there's a diagnosis in the question. We practiced that a little bit this evening. And then that will help to give you an indication of what class the medication is in. So for example, if the question read, a client with heart failure is taking furosemide, then you want to think about the pathophysiology of heart failure, and probably that furosemide is going to be something that treats that fluid volume overload, and then you can get it into the classification of a diuretic. Or another example might be a client with breast cancer is receiving cyclophosphamide. You might then make that connection and think about cyclophosphamide as possibly being a chemotherapeutic drug. And then, Linda, do you have any other tips that you want to add?
No, you're doing a great job.
Okay, just a couple other things that I'm thinking about too. The prefix and the suffix in medication names, you can try to learn those commonalities in those medication names, and that can help you to determine if a medication belongs to a particular class, and that can then help you in answering the question. So if you note that the medication name in a test question, you see the name, but you're not familiar with the name, if you can at least associate the medication with a class, you'll then hopefully be able to determine the action, side effects, and nursing interventions. So take a look at the letters in the name and look for those that may identify a particular med classification. So for example, ACE inhibitors, most of those end with the letters PRIL, like lisinopril or enalapril. Another one that I can think of is antiviral medications. A lot of those contain the letters VIR, such as ritonavir. And then beta blockers, they end with LOL, such as atenolol or metoprolol. Glucocorticoids and corticosteroids, Linda mentioned that, ends with the letters SONE, such as prednisone. And then with your sulfonamides, most of those medications include SULF in their names, such as sulfamethoxazole. Most thyroid medications contain THY in the name, like levothyroxine. And then your xanthine bronchodilators, most of those end with the letters LINE, such as theophylline. So if you can study those and recognize those, that will really help you to get medications into the classification, and then hopefully be able to answer whatever the question may be asking about. If you are able to remember the therapeutic effect, common side effects, adverse and toxic effects associated with medication classifications rather than individual medications, that will really help you to scale down the amount of information that you need to remember.
Thank you. That was awesome information. Going off of the number of questions that you had just mentioned, taking practice questions there was a couple different questions coming in from students about the 3,500 to 4,000 practice questions that you recommend taking before the NCLEX, and whether that is all practice questions, just pharmacology, and how long you recommend. Is that your senior year or through all of nursing school? I know that's multi-layered, but yeah.
Okay, well, the 35, and Angela, you jump in after if you have something to add. The 3,500 to 4,000 practice questions is not just pharmacology questions. It is questions in foundations, maternity, PD, adult health. You really want to be strong there. Your mental health and questions, and your pharmacology questions. Now, many students have the comp review books when they begin their nursing program, which is ideal because as you're getting ready for a nursing exam, let's say it's maternity, you can practice all of those questions in that maternity section on Evolve and in the book to get ready for your nursing exam. And you're getting ready for NCLEX at the very same time. Again, we want to emphasize how critically important it is to read the rationales and the test-taking strategies. So it's 3,500 to 4,000 more if you can, but while you're in nursing school and throughout your senior year. And then when you get to your senior year, if you've sort of exhausted that comp review book, with practice questions, that's when we really recommend the Q&A book, because as we mentioned previously, they're higher level questions. They really test your clinical judgment and the ability to make sound judgments in the clinical situation. Anything to add, Angela?
I think the only thing I would reiterate, Linda, that you already said is that you really shouldn't count the questions that you're practicing towards that total unless you really are paying attention and reading those rationales and reading those strategies, because you would be doing yourself a disservice to say to yourself, okay, you know, I know this book has 6,000 questions. I've gone through the whole book, so I've done 6,000. But if you weren't really like doing it at your best and really paying attention, then I would caution you on counting those and would tell you to, or advise you to kind of take a step back and, you know, maybe come up with a plan that would be fair to yourself and true to yourself that would really truly cover that 3,500 to 4,000.
That's a really great point that you made. And it brings to mind that what is really important is at the end of your courses, many of you take standardized examinations, and then you may take an exit exam or an exam at the end of your program. With these standardized tests, you really need to take them seriously, and you can use the results on these tests to help guide you with where your strengths and your weaknesses are, because then that is an area where you really want to focus when you're doing your practice questions.
Thank you. A bunch of questions coming in about how there's just so many medications to remember in pharmacology and all the different drug effects and contradictions and indications. And when you sit down to study for pharmacology, how do you recommend approaching all that there is to know and to learn?
Okay, yeah, and I think Angela might have touched on this a little bit, but one of the things is approach your studying and review by medication calculations. And the reason we recommend this is because medications that belong to a particular classification are going to have similar med actions and usually have commonalities in their side effects and nursing interventions related to administration. And it's nearly impossible to learn every feature about every individual med. So we don't want you to be trying to do that. Learn the meds by the classification system method that groups meds with similar properties together. And that makes the amount of information that needs to be learned condensed and very manageable. So for example, group all your beta blockers together. Remember that most of their names will end in LOL. Then group their intended effects, which are all going to be similar. Group the side effects and adverse effects and the nursing interventions, including patient teaching, and that is all going to be similar. So the classification method is really, really important. Anything to add, Angela?
I think maybe the only thing that I would add to that is that a lot of the pharmacology textbooks out there will present information using the classification method, and they will likely identify a number of prototype medications or the most common medications that in a way represent that particular classification. And so you could really kind of get to know maybe the top 3 or 4 medication names within a certain classification. And then from there, as you had just described, Linda, learning all of those other things associated with the entire class. So it really is kind of a method that you'd have to use to learn and then to get to know those things. And then I would also advise you to make the most of your clinical experiences when it comes to learning your medications. That's really an opportune time to apply this information that you're learning to a real patient or client care scenario. And that really, really helps to solidify and helps you to remember what a medication is used for, if you can tie it back to some of those clinical experiences. And then that really helps you to then understand kind of what a treatment regimen might look like for a certain condition, with medications coming from multiple different classifications. And then also interactive effects is another thing that would help with. So clinical experiences and then case studies also help with kind of tying all of those pieces together. But if you start with learning the classifications initially, and then as you're getting closer to taking your NCLEX, kind of putting those finishing touches on the pharmacology content by reflecting back on those clinical experiences and then maybe using some case study resources is really helpful.
Wow, that answered on most of the questions and was really awesome. I think that there was one other question I wanted to touch on, and I thought it would be a good note to end the night. What do you recommend for students with test anxiety? As you know, semesters are going to be wrapping up in a few months here, and yeah.
Well, there's lots of little tips for test anxiety. And Angela, I'll turn this over to you after I just make a few starting points here. You need, first of all, you need to be prepared for your exam. And if you're going to be prepared for your exam, that's going to help some. You need to think about some techniques that will work for you to keep your mind focused. So deep breathing always helps. That helps an awful lot of people with helping them to focus and direct their attention to what they're doing and relieve that test anxiety. So you breathe in through your nose, hold that for a count of 4, and then breathe out through your mouth. Now remember, when we have postoperative patients in the clinical area and their pulse ox drops, what do we tell them to do? We tell them to deep breathe. That's the first thing we ask them to do, is to deep breathe. And we watch their pulse oxes most of the time go right back up again. Well, that's why deep breathing is important, because it's going to help to bring a lot of oxygen into your body, and it's going to bring it to your brain where you want it the most when you're taking an exam. The other thing that I have seen happen with students is when they're coming to class and they're taking an exam, they'll all congregate outside the classroom till the classroom is empty from the previous group of students that were in there, and they all start talking about what they studied, what's going to be on the exam, what this, what that. And what I say to you is to move away from those groups and not listen to that, because that's only going to increase your anxiety. If you start hearing other people talking about what they think is going to be on the exam, and perhaps maybe you didn't study that enough, or you feel like you didn't study that enough, that's only going to increase your anxiety even more. Healthy-wise, stay away from coffee, eat a good breakfast. Those complex carbs are really good to feed your body and feed your brain. What else to add, Angela?
Yeah, thank you. Those are all really great tips and excellent starting points. And if you are not, if you're finding that you're still struggling with this after doing all of those things and then doing the pampering and the self-care and finding the balance between school, work, personal life, and you're still struggling with this, universities, colleges, they've got resources that you can be referred to or seek out on your own. And I would recommend that you do that. And it may be pursuant to, for example, the American Disabilities Act, where there's a resource center that works with students who may have a documented or undocumented disability. And there may be some accommodations that could be put in place that will help, specifically with taking anxiety. And it may be things like maybe you need extra time, like 1.5 times on an exam, and that would be substantial enough to help then reduce the anxiety. So that's just one of many examples that those resources typically can offer to students. And I always say the sooner you can get something like that in place, if you need it, the better. And if you don't need to use the accommodation, then that's okay. At least you have it in place in the event that you do need it. These accommodations also are applicable for the NCLEX exam as well. You just have to follow the processes to have that set in place for the exam through your respective state board of nursing that you're applying for licensure with. And then certainly working with your healthcare provider, and perhaps working with counseling. Those things may be tremendously helpful. And even though it may take time to seek out those resources, in the end, they end up being a time gain for you, in that you won't be chasing your tail trying to raise a grade on an exam so that you're successful and it doesn't inhibit your progression in your program, and so that you don't have to come back and repeat a course or something like that. So just consider those things and consider the resources that you have. Talk to your faculty advisors. They're often an excellent resource to be able to refer you appropriately. And then ultimately, in the end, I would probably end on this note. If you think that there's not an option available for you to help you to be more successful, that's probably not the case. And you need to just ask those questions and kind of voice what you're experiencing, and more often than not, somebody somewhere will be able to help you to navigate those things.
Right, and sometimes it's just a self-assessment or someone to help you assess what it is that is causing your anxiety. And if you can pinpoint that to some degree, then that's where your focus can be to help relieve it.
Absolutely. Yeah.
Thank you so much. It's been such a great evening, and we hope that you all enjoyed the review as much as we did. And thank you, Linda and Angela, for all of your time tonight with us. I know it's been appreciated. And yeah, everyone have a great rest of your evening.
Yes, have a great night. Thank you very much.
Thank you, everybody. Have a great night.